When describing a pharmaceutical company, most people wouldn't think about a company focused on patient advocacy, or one that's dedicated to making sure people, our loved ones and our neighbors, regardless of their station in life, have access to critical medicines. When we started Harrow, we believed we could be a different kind of pharmaceutical company, one that focused on the needs of people, one that honored eye care professionals, one that ensured patient access and made affordable products. In other words, a completely different kind of pharmaceutical company. Allow me to share Harrow's incredible story. I'm Mark Baum, and in 2011, along with Andrew Boll and a small group of investors, we started Harrow. We're in the eye care pharmaceuticals business, which means we make a suite of medicines for patients undergoing various kinds of eye surgeries, like cataract surgery or LASIK. We also make prescription drugs to help patients manage chronic eye conditions like glaucoma, myopia, and dry eye disease. We are a true startup. In the beginning, we literally had no products and no customers. But we're entrepreneurs, and we believe it is possible to not only reimagine products, but entire industries. We aren't dissuaded when things don't go our way. Setbacks are not fun, but when you're a principles-based business, you view setbacks as an opportunity to learn and get it right. And in our case, we are getting it right for all the right reasons. These days, we serve more than 10,000 US customers, like doctors, hospitals, and surgery centers, with dozens of important medicines. We ship millions of product units each year, and because of our core principle of dedication to patients, we see our growth continuing for many years to come. Regardless of why you're interested in Harrow, I think it's important for you to know where our company came from, where we are now, and importantly, where we're going.
Well, it wasn't a straight line getting to where the company is today. I watched Mark, his team, board of directors, over and over again struggle with important decisions that some of them could have led to the demise of the company. But over time, those decisions turned out to be the best decisions for the company, and we're now in a very good position to move forward.
As an ophthalmologist, I'm sort of old-fashioned, if I will, but I make most of my decisions on patients first. And when I'm trying to decide whether to support a company or to support a product, it has to be very patient-focused. And one of the things that attracted me to Harrow was that from the beginning, both the board and Mark Baum and Andrew Boll were very patient-focused, trying to do the best thing for the patient. So their philosophy fit perfectly with mine. Harrow not only is innovative, but they also work really hard at the quality side of the equation. And so we've learned to trust them. They just become a great trusted partner in ophthalmology.
I'm John Saharic. I've been with Harrow for almost 10 years now, and it's been an exciting journey. What makes our business model unique is that we have everything that eye care professionals need to take care of their patients.
Well, Harrow is a company that is focused not only on branded pharmaceutical products, but also what's called compounded pharmaceutical products. So it's the only ocular pharmacology company that does both branded and compounded products.
My name's Dennis Sadeh. I've been with Harrow since January of 2015. I lead the product development team. I'm a pharmacist by education. I've been practicing for over 30 years. My professional passion has always been to solve unmet needs through the use of specialty pharmaceuticals. Harrow's been able to grow rapidly because we've been able to address those unmet needs.
At Harrow, patients are our priority. And we live out our commitment to those patients by making really important medicines available across our country at a fair price. Sometimes our commitment to patients goes well beyond the walls of our office. It puts us on the front lines of patient advocacy, fighting for affordable, accessible medications for those who need them most. As one of my idols in American business, Warren Buffett, has said, "Always take the high road. It's the one less traveled."
So what made me want to join Harrow was doing my due diligence on the company, and I was Googling, and I found a bunch of videos about Mark Baum, the founder. One of them was him in a tuxedo outside of Oxford Union in London, and he was talking about drug access and affordability and how this was needed more in the pharmaceutical industry, and he was winning the debate against this huge pharma lobbyist.
Through their actions, we see greed. We see a desire to maximize profits, regardless of the plight of patients. But by the way, when it comes to new drugs, patients don't get a break, and the sick don't get access. This debate affects all of us and everyone we love. I ask you to not only support the motion, but to support access and affordability and competition. You can start tonight by voting for the motion. Thank you.
And that was the moment I knew that I needed to be working with this company where this guy from the small company in Nashville is taking on these big guys. Man, that was awesome. And I said I had to be part of this company.
I heard about Harrow for the first time when I read a press release about a woman whom I greatly admired joining Harrow's board of directors. I was curious about the company and learned that Harrow was the company that took on Martin Scarelli, who was responsible for increasing the price of Daraprim by 5,000% overnight. Then I saw Mark Baum on television talking about lowering drug prices and acting by making a 99-cent alternative to the $750 Daraprim pill.
Infamous founder and CEO, Mark Baum.
And then we decided to take action to make this new formulation available to this vulnerable population.
You're selling it the equivalent for $1. Are you taking a loss on this?
No. The chemicals that we use to make this formulation are quite inexpensive. We make a really nice profit on this, but we make what I feel is an ethical profit.
It was a perfect opportunity to right a wrong, and it felt good to live up to our guiding principles.
Well, one of the major impacts that Harrow's had on patients is providing products that we never had before. I'll just use cataract surgery as an example. We used to prescribe 3 separate drops. It was also quite expensive, often $600–700 for the patient to buy all those drugs. At Harrow, we provided all 3 drugs in one bottle at a very reasonable price, about $55. And so that was very disruptive, right? I think organized ophthalmology and the large pharmaceutical companies actually were surprised at the size of the impact that Harrow has had.
Patient advocacy at home matters greatly, and so does our mission work around the world. Thanks to our principles and financial footing, Harrow is having an impact globally.
At Harrow, we're building a different kind of pharmaceutical company. We're impacting lives. We've been nimble and able to address unmet needs with creativity and innovation together with our physician partners. And importantly, we're making clinically relevant medications affordable for patients, allowing them access to treatments where they sometimes would not have.
I'm Andrew Bohl. I'm a founding shareholder of Harrow and serve as our CFO. Mark and I have worked together since 2007. A big part of what I do is to make sure that we have the financial strength to live up to our principles. As an example, I'm involved in helping to price all our products, which means finding that sweet spot of our prices that can't be too high or too low. They need to be just right so that we can ensure that we meet our ethical commitments and deliver a reasonable profit. All of this needs to align with our vision for the business, to be advocacy-based, to put people first, to put patients first. I'm the guy who tries to make sure we have the money to do all that.
Well, a lot of us, including myself, do what we would call missionary work, and we'll travel around the world in areas that have need and do usually surgical procedures. And so Harrow has been very supportive in providing those products at no charge for those of us that travel around the world to do this type of missionary work.
The team is very proud of the fact that we have never turned down an opportunity to support a doctor on a mission trip. The fact that we have those values and that we live by those principles, that's what really makes Harrow a special company.
Relationships are our most precious resource. We focus on attracting, developing, and retaining the best talent for our business, challenging our people, demonstrating a can-do attitude and fostering a collaborative and mutually supportive environment.
We believe very strongly that we wouldn't be where we are today without the commitment, talents, and hard work of our employees. So it's important that our employees feel valued and appreciated for their contributions and are vested in our future. So in early 2022, we implemented an employee stock option plan so that every employee could be an owner of the company.
I'm Laura Sherry, and I've been at Harrow since 2014. I'm a leader on the accounting team, and I've witnessed firsthand Harrow's revenue growth, which has been fast and steady. Harrow continues attracting incredibly talented people. We are committed to training and career growth for everyone in our organization.
My name is Kenya Beverly. I am the executive assistant to Mark Baum, the CEO, and I'm also the office manager. I have been with Harrow since December 2019. I interviewed with Mark and Andrew Bowl. They were so personable, and I just fell in love with the whole culture, and so they offered me the job and I accepted.
My name is Paulina Velasquez, and I started working at Harrow over 6 years ago as a temporary employee. When I started at Harrow, I didn't have a college degree, but Harrow invested in me through training and career development. They encouraged me both emotionally and with financial aid to finish my college degree. That enabled me to advance in my career, and I am now an accounting supervisor. It's been a great ride from being a temporary employee to being a respected leader in our accounting department.
I'm Garrett Scarborough, and I joined Harrow to build software and support our IT needs. I've worked hard to build the infrastructure that knits our business together and was recently promoted and now oversee our IT department. I've also recently received another very important promotion. I'm a new father. Mark has always been a big supporter of family first, and when my daughter was born, he was true to his word. He encouraged me to put being a husband and a father first. I feel that I'm a very fortunate person. I have a great family life, a great work life, and a bright future ahead of me.
My job is to use technologies to advance the experience for patients and doctors when they're interacting with our pharmacy. I'm also focused on customer care, and so we're constantly evaluating the experience, honing it, improving it, so we can have the best experience of any pharmacy in this industry.
We began generating revenue early 2014 with a single injectable product produced from a small facility in Randolph, New Jersey. Today, our current production and distribution facility is much larger and includes automation, robotics, and sustainable energy. Our sales organization stretches across the United States, and we have customers in nearly every populated county across the country.
Professionally, it's been the most rewarding environment I've ever worked in. I feel blessed to be a part of a dedicated team of leaders and operators that all share the same vision.
What excites me most about Harrow is our future. Because of what our team has built, we are on the cusp of becoming one of the nation's leading ophthalmic pharmaceutical companies. We are building a company that will last far past my tenure as CEO, helping to preserve the gift of sight for future generations. I hope what you've heard, a bit about our story, our history, some of the great people who make up the Harrow family, and some of the events that led us to this point in time, fills you with the same sense of excitement and confidence in the future of Harrow that I feel. If you're a member of the Harrow family, an employee, or a family member of an employee, I also pray that you feel a sense of pride in playing a vital role in shaping the future of Harrow, a company that is compassionate and supportive towards people. We're authentic and ever agile as we meet this opportunity to build a truly different pharmaceutical company.
What I love at Harrow is that every day I get to work on improving accessibility and affordability to drugs for our patients.
I love that people are not afraid to roll up their sleeves and do whatever it takes to get the job done.
I love working with folks who have a real passion about what they are doing with their life.
What I love the most about Harrow is the culture and the people and the collaboration that we all have together.
I love the passion that everyone has for increasing the patient experience, and the free snacks really help.
I love the people that I work with. You know, you spend most of your waking hours with the people that you work with. So you want to make sure that it's with individuals that you enjoy and for an organization that you're passionate about.
I love the fact that we're helping patients with eye conditions every day.
I love that I get the opportunity to think creatively, to come up with solutions that are outside the box, and then work with great people to refine and execute the plan.
I love working with a dedicated team of individuals that help patients every day.
I'm very excited about what's in store for Harrow, and I hope you feel the same way. Personally, I can say without reservation that I love my work, and I love this company.